Here's how some people think about a hair transplant. You go to Turkey, pay a few $1,000s, you restore your hair with no downsides, cheap and easy, right? Wrong. Hair transplants are much more challenging to get right than what most people think. It's not just the technique that matters. Let's review the 7 most common reasons why hair transplants fail. Selecting the wrong patient. Some people have an underlying hair condition, and that could be a scarring type of alopecia with active inflammation. There are scarring alopecias that have essentially burnt out, so there's no longer active inflammation, and if you do a biopsy to confirm that and you see that, hey, the inflammation is no longer there, you can then still proceed to a hair transplant in most cases. But you have to be careful. Also, some people, like myself, have active alopecia areata, so it's quite unreliable to take from areas that could be affected by alopecia areata, both in the donor area and in the potential recipient area. Also, some people have underlying medical conditions, and this could include, for example, uncontrolled diabetes that will then affect the healing of the area after a hair transplant, and it can also be things like thyroid problems that if they're uncontrolled, you can also continue to lose your hair. Also, patients who are unable or unwilling to follow post-operative instructions are not the best candidates because patient cooperation after a hair transplant is very important. You want to make sure that they're applying the right solutions to their scalp, that they're washing their hair at the right time, that they're avoiding different types of behaviors that can lead to graft loss. However, it is difficult to mess up a good hair transplant when it's been performed properly. It takes quite a bit of effort to make those grafts pop out. And then of course you have patients with just unrealistic expectations. For example, they might be starting off with a ton of loss and they're expecting you to completely restore them back to how they were before they developed any hair loss, and sometimes to do that with a single surgery. And those are patients who just need some explaining, and if they still don't get it, then it's better to turn them away because you don't want a patient who at the end of this entire journey will end up just disappointed with their results, and part of that has to do with proper selection of patients. Another reason is a lack of hair stability. So I'm always looking for stable hair before I proceed to a hair transplant, and I want the hair to be nice and stable for at least 6 months prior to surgery. I always tell patients that I'm looking for a stable foundation that I can then build on. If it's a shaky foundation and the hair is falling out and you don't exactly know how it's going to look in a few months, it's very difficult to design a hair transplant properly and to execute it well where they won't end up worse than how they were when they first got to you. Keep in mind that surgery is a form of controlled trauma, and when you do a transplant, you can actually encourage hair to fall out quicker, and that's something that often people don't quite understand. And so what I mean by that is that if I'm doing work at, say, the frontal scalp and there's already a decent amount of hair there, but it's weaker hair that has been falling out for the last few months, then the problem is as I do my transplant and I'm making all these different sites and we're putting grafts in, we're essentially causing some trauma to the area that could encourage some of that hair to fall out faster. And so you have to be very careful taking on patients where hair is still falling out. And so that's always one of the first questions that I ask during a consultation. And then in order to get your hair more stable, right, because that's the next obvious question, how do I do that? Well, that's done with medical therapy. It's not done with surgery. To find out more about medical therapy that can help you stabilize your hair, head to feelconfident.com. Another reason for a potential failed hair transplant is poor design. Some people place hairlines too low. Some people place hairlines too high where you don't have proper facial framing. Sometimes you can have a faulty shape to the hairline as it's created. And other times the problem is actually with the way that the temples are addressed or not addressed. It's an important consideration when you're doing hairline work whether or not you want to recreate or restore the temple hair or just leave it alone. And some of that has to do with patient preference, some of that has to do with the pattern of recession, and some of it has to do with whether or not it's worth the investment of grafts into the temple area. The temples usually take about 200 to 300 grafts to begin to have them look more restored. So if you have a case where there's a ton of loss in this whole region, frontal scalp, mid scalp, crown, you may not want to invest those grafts into the temples. It might be better to use them up top. So again, that's a conversation between surgeon and patient to properly plan the surgery. And remember that hair transplant surgery is essentially art, right? And so you have to have the vision as the surgeon, and I truly believe that that cannot be taught. So I think you can teach someone to do hair transplant surgery, but to give them the vision for how to artistically create a hairline and to blend that in with the surrounding hairs properly, I really think that you need to have an artist's eye to do that well. Another reason why hair transplants sometimes fail is because of over-harvesting. If you harvest too many grafts in a single session, you can have something called shock loss in the donor area. While this is usually temporary, it can actually limit your ability to harvest more grafts in the future if in fact that shock loss ends up being permanent. And when you over-harvest, you end up with worse scarring, because those individual scars that you get from, say, an FUE surgery end up sometimes fusing together, and that longer type of scar will end up not healing as well. This is akin to, say, fractionated laser procedures or micro-coring procedures, where you have individual areas that are removed with healthy surrounding skin, and so those little spots of either trauma from a laser or micro-core that's removed can then fill in and heal much faster because of the healthy surrounding tissue. And that's the same with FUE surgery. So if you over-harvest, you end up with bigger scarring issues. The other problem with over-harvesting as it pertains to FUE surgery is that you're now expanding your overall harvesting zone, and as you do that, some of the hairs that you harvest will be DHT sensitive or susceptible to falling out over time, even once they're transplanted to the new location. Another potential reason for a failed hair transplant is overgrafting. It is possible to transplant too many hairs into a specific area. Keep in mind that every part of the scalp or any part of the body has a limited blood supply, and every time that you move a graft into an area, you expect it to link up with the blood supply of that zone. So if you have something like scarring, you'll have less blood in the area, and so there'll be less that will attach to those grafts to allow them to live and to, grow. But even if you're not dealing with an area of scarring and it's just healthy scalp, there's still a limited amount of blood to feed those grafts. So if you overgraft, in the best case scenario, you just get poor survival of the grafts that you've placed. But in the worst case scenario, you can actually cause bigger problems like tissue death or skin death called necrosis. The entire area of skin dies because you've now diminished its blood supply by putting so many grafts into that zone. And you can also get shock loss in the areas of the recipient zones. So where you're now placing the grafts. So if you're moving grafts from the back of the head to the front, if you still have some hair present, you can experience some shock loss if you've moved way too many grafts for the size of that zone. Another reason for a failed hair transplant is low density. One of the reasons for this is that too few grafts are transplanted into the recipient area. And this is one of the reasons that I like to start my surgeries with site making at the recipient area to get a good sense of how many grafts we're going to need. Because sometimes areas can be a bit deceptive in that maybe you thought you needed 500 grafts to fill an area, but in reality, to get good density, as you start making sites, you realize, hey, I really need 800 or maybe 900 grafts. And that's going to better inform you once it's time to do the harvesting for that surgery. Another reason for getting low density is poor survival of your grafts. One reason for this is getting transections as you're harvesting. And this could be because of the machine that you're using, could be because of the angulation that you're harvesting at. If you're harvesting at an improper angulation to the natural angle of the hairs, you're going to essentially cut through the bulb and you're not going to capture the entire follicle properly. And another related reason is sometimes the punch is actually too small. If the punch size is small, you're going to be partially transecting. So you'll be missing some of your bulkier grafts, like your 3s and 4s will get partially transected into singles or doubles. And that will ultimately impact the density that's created at the recipient area. Also, poor survival can come from improper handling of grafts by the surgeon and or his team. Grafts can dry out if they're not properly kept in the holding solution. Also, if the people who handle the grafts are a bit too rough, you can damage the hair by trying to slam it into the holes or into the sites that were created. Or when you go to use your forceps to pinch the graft, if you pinch too firmly or right at the bulb, you can also be hurting the grafts. So you need a nice soft touch and a nice soft implantation into the site. And poor survival can come from improper post-operative care. Letting the grafts dry out too much, or disrupting the grafts, or rubbing against the grafts can all lead to poor survival of grafts. And another reason for a failed hair transplant is an unnatural type of look. This could be because your hairline has grafts that are too bulky instead of nice single hair grafts that are nice and fine and irregularly placed at the hairline. The exit angle of the hair from the scalp can be improper, and that often occurs when the temples are recreated because of how acute that angle is. And if you're not acute enough, you can have the result look quite unnatural. The direction of hair growth is very important, especially when the person has existing hair in the vicinity. You need to try to match that direction as you're working and creating your sites. In terms of density, that can also be a factor involved with creating an unnatural appearance. If you have too low of a density, then it's going to look like the hair is just too sparse, and you might need to come back with additional transplants. If you have too many grafts in a specific area and the surrounding areas actually look like they are more sparse naturally, that can also lead to an unnatural type of appearance. You want the densities to more or less look similar to what was there before, or overall better, but you don't want an area, say on the left side of the frontal scalp, to be quite dense, and on the right side of the frontal scalp to be a lot less dense. So those densities need to make sense for those specific areas that you're working on. It's also important to have enough irregularity in the hair design, and so this is not just at the hairline, this is also for further back, because what some people do is they create rows of transplanted grafts that look like these perfect rows. Our hair doesn't grow naturally like that, so again, if you do that, that's going to look unnatural. But to create naturality, you need to start to stagger those hairs and the way that you've placed those grafts. And that's, again, not just important right at the front, where people think that you need irregularity there, but not further back. You need irregularity throughout the areas that you're working on. So you want to make sure that you have both micro irregularity, and that's in the form of that type of staggered pattern, and macro regularity, so that overall, when you look from afar and you zoom out, you don't have this kind of perfectly straight line at the hairline or something like that. And the depth at which you place the grafts is also important, because if your depth is too shallow, then what happens is that the grafts don't fully take and they can actually not survive and fall out. If your depth is too deep, then what happens is that you can have the graft start to sink into the hole, and if it sinks too low, then that leads to potential pitting. So pitting is where instead of placing the graft where it's slightly coming up over the surface of the skin, and as it heals, it'll flatten perfectly with the surface, if you place that graft deeper, that skin is now deeper, and so then you'll end up with a pit as it heals. And so again, depth of site creation and depth of implantation is very important for a natural result. And I have a video on how to fix a receding hairline where we go through all of these factors in detail. So why do people choose to come to my clinic, even though we're not the cheapest option? Well, we have an expert team, and that's not just me, it's my entire team. We have a nurse, we have a PA, we have several extremely experienced technicians, and everyone's handling your graft. So you want to make sure that every team member is extremely knowledgeable and experienced. Most people will come to us because they want a natural type of look. They don't want people to necessarily know that they had a hair transplant. So creating that naturality requires all those things that we've talked about in the video, and it's not that easy to do that well and to do that consistently. Patients also come for the artistry of it. They understand that they want the hair to just overall look good, but they don't always know what to ask for. So we are here to advise them and to give them the best possible artistic result. We have a policy of no BS. We are just straightforward, honest people, and that of course is very important when people are shopping around. They're getting all types of information thrown at them. They understand that, someone's trying to sell them something. So I think coming to a place that's a little less biased and willing to tell you the truth, and even if that means losing business, that's the type of place that many people want to deal with. And most importantly, people are coming here for peace of mind. They are coming for quality. They're not coming because it's the cheapest place or where they're going to get the best bargain. They're coming because they don't want to worry that they're going to end up looking bad, that they're going to end up looking unnatural, that they'll end up spending much more money to repair some of the damage that may have been done with initial surgeries that maybe, didn't stress all of these important points. So that's why people come to my clinic. And a hair transplant is a major aesthetic decision that's for the most part irreversible. So be smart about the decision that you're making related to where you're going for this type of procedure.